Hi everyone! Today we'll go through two high-yield USMLE questions, one on pediatric dermatology and the other one on pediatric bone lesions. We'll break down the correct and incorrect options to understand the key clinical features, diagnostic clues, and the reasoning behind each choice and strengthen our approach to similar exam questions. So let's get started. During the neonatal examination, immediately after delivery, a full-term newborn girl of African American descent is evaluated by the neonatologist. She was born via an uncomplicated vaginal delivery and appears healthy. However, on physical examination, a flat, bluish-gray, well-demarcated patch is observed on her lower back. Which of the following is the most likely diagnosis? A. Birth trauma. B. Cavernous hemangioma. C. Dermal melanocytosis. D. Nevus flammeus. E. Pustular melanosis. Now the key aspects to consider in this question is, number one, the lesion is present at birth, so this suggests a congenital condition. And the second point is that it's flat and bluish. This rules out raised or vascular lesions. And the third point is the location at the sacral region. This strongly points towards Mongolian spot. And the fourth point, which about the ethnicity, it's mentioned African American. This also points towards Mongolian spot as it is more common in darker skinned individuals. So the correct option here would be C, dermal melanocytosis, which is also known as Mongolian spot. These are blue-gray patches that appear in the sacral, gluteal, or back region of the newborns, especially in dark-skinned infants. They're benign and they require no treatment, and they gradually fade within the first year of life. So this option matches our patient's presentation perfectly. Let's have a look at why the other options are incorrect. Option A, birth trauma, is incorrect because bruises or ecchymosis from birth trauma appear variegated and raised. And birth trauma is often associated with forceps or vacuum delivery, not a normal vaginal delivery. Option B is incorrect because cavernous hemangioma, it's a vascular lesion that appears as a deep blue raised mass with indistinct borders, and it is compressible on palpation, which is not the case in this newborn. And option D, nevus flammeus, this is a pink-red flat hemangioma commonly seen on the nape of the neck, the forehead, or eyelids, and not on the sacral area. And unlike Mongolian spots, nevus flammeus does not fade over time. Option E, pustular melanosis. This is a transient neonatal rash seen in darker skinned infants, but it appears as vesicles and pustules that erode within 48 hours, leaving hyperpigmented macules. Let's have a look at the second question. A 12-year-old boy comes to the pediatrician with worsening pain in his left upper arm. He initially injured his arm during gymnastics practice about a month ago, but thought it was just a minor strain. Over the past few weeks, the pain has progressively worsened, becoming more severe at night and unresponsive to over-the-counter pain relievers. He has also experienced occasional low-grade fevers, fatigue, and unintentional weight loss. On physical examination, there is a firm, tender mass over the proximal humerus with surrounding swelling. Laboratory tests show an elevated white blood cell count, increased LDH, and a high ESR. Radiographic imaging of the arm reveals a destructive bone lesion arising from the proximal humerus, and a subsequent biopsy demonstrates small, round blue cells. What is the most likely diagnosis? A. Chondrosarcoma. B. Ewing sarcoma, C. Osteogenic sarcoma, D. Osteochondroma, E. Osteomyelitis. To approach these type of questions, we need to consider some key points. The first point here in this question is the age of the patient. We should take this into consideration because certain cancers happen in certain age groups. The second point here, the patient history. Now, a child who is having pain worsening over weeks with fever, malaise, and palpable mass suggests a malignant process rather than a simple musculoskeletal injury. The third point is that the key lab results. The elevated white blood cell count, the LDH and ESR, all suggest inflammation or malignancy, and these findings guide us toward considering tumors or infections. The fourth thing is that the radiographs and biopsy. Now, the radiographic findings of a large mass arising from the proximal humerus and the biopsy showing a small round blue cell tumor are pivotal in narrowing down the options. The correct answer here would be B. Ewing sarcoma. This boy most likely has Ewing sarcoma that commonly affects the children and adolescents. It typically presents as a permeative lytic lesion in the metadiaphysis or diaphysis of long bones, in this case the proximal humerus. The presence of a soft tissue mass, fever, malaise, and the classic small round blue cell tumor on biopsy all point towards Ewing sarcoma. Let's have a look at the incorrect options. Option A, chondrosarcoma is a malignant tumor of cartilage and it's primarily seen in older adults and not typically seen in children or adolescents. And it presents with cartilage-based spindle cells on the biopsy and not small round blue cells. Therefore, this is not the correct option. And option C, osteogenic sarcoma. Now, osteosarcoma is the most common primary bone tumor in children, but it has a distinctive feature. Radiologically, osteosarcoma usually shows a mixture of lytic and sclerotic areas, and the tumor cells are surrounded by bony trabeculi or malignant cartilage. Option D, osteochondroma. Osteochondroma is a benign bone tumor that typically presents as a cartilage-covered bony excrescence. It is a painless mass and it is usually asymptomatic. And option E, osteomyelitis. It is an infection of the bone that can cause pain, fever, and swelling. However, osteomyelitis typically does not present with a large mass or the findings of a small round blue cells on the biopsy. It also doesn't cause the same pattern of the night pain and the fever that would point towards a malignancy. Thus, osteomyelitis is not the correct option here.